Hello, my name is David and I'll be discussing about post-operative care. So what is post-operative care? Post-operative care is the care given to a patient that has undergone surgery and is in the recovery process. So there are basic things you need to carry out in order to assist the patient through this post-operative period. The first thing is that the patient is usually taken to the recovery room and is handed over to the head nurse. So here the nurse receives information about how to take care of the patient and if there's any special requirement she needs to carry out. So after the nurse assistant has received the instructions on how to take care of the patient, she begins. So the first step is to take the temperature of the patient and see that it's stable. She also has to take vital signs at least every 15 minutes for at least 3 hours and every 1 hour for the next 4 hours. Also, she needs to check for the blood pressure of the patient, the pulse of the patient, and also the IV solution to see that it is stable. Also, I'll be explaining how you need to change the position, the patient position. So you need to change the patient position starting from the supine to the prone to the left side and to the right side. And you do this so that you avoid pressure ulcer. So now, assuming this is the patient, now the patient is in supine position. Every 2 hours, you need to change the position of this patient. So first of all, from supine position, you change the patient to side position facing left, and also next change it to a prone position, and also change it to the right position until finally changing it to the fowler position. You do this every 2 hours so as to do this to avoid bed ulcers. Also, when the patient is doing surgery, you never put a pillow. Only put pillows during for patient when patient is unconscious. So you put the pillow until the patient's head a little to the left. So apart from changing the patient's position, you also need to assess the surgical site and see how the patient is doing, whether it is still painful or they are getting better. You also need to help ambulate the patient because blood clots to be formed during the surgery process. So you need to help your patient to exercise and move its muscles. So you help the patient ambulate every 1 hour or 2 hours so that blood clots doesn't form. So you do all of this postoperative care in order to keep the patient healthy even after surgery. Thank you.